Hi, my name is Angelica, and this is the Angelica Unfiltered podcast where I talk about health, wellness, weight loss, but mostly fat acceptance. This video has been suggested to me on YouTube. The platform recommended it to me, not you guys. So I thought I'd watch it today. It is episode 41 of the Fab Fatties, Why Fat People Avoid the Doctor, the Nuance of Health and Compassionate Care. 2.4K views with 70 thumbs up, so that's a pretty horseshit ratio, in case you don't know anything about posting online. One of you guys got annoyed from me not watching the video at full screen, so I did it at full screen, but then I feel like you can't see me as much, or like I tried to like crop the video, so hopefully everything looks good for your aesthetic view. I'm gonna watch it at 1 1/4 speed, so let's see what Dumb and Dumber have to say. To add on to the video I posted last about them, this one claims to have type 3 diabetes, and there have been like some medical studies that have shown that like type 3 diabetes is like a newer diagnosis, or people are like saying type 3 diabetes is a result of diabetes that causes dementia. So that's why I like was kind of poking fun at her for saying that she has type 3 diabetes, because this woman is in her fucking mid-30s. I don't think anyone that young has ever had dementia. Like usually people in maybe their 50s, 60s and 70s get it. Like it's usually for old people. So I don't know if her doctor told her something incorrect, or I don't think there is like enough advanced technology to pre-diagnose her with dementia like 40 years early. Or maybe she thought having type 3 diabetes was cute and quirky, so she decided to stick on to that diagnosis but not do anything with her health. Who knows? Who knows? Maybe she'll talk about it more in this fucking podcast.
Everybody, and welcome back with the Fab Fatties.
I love this green shirt. I also wish I had her curls.
My name is Alyssa.
I'm Rebecca.
And I'm Allie.
We are really excited for today's episode. This topic has led to, I don't know, some really deep, difficult conversations behind the scenes. Has absolutely led to confrontation. It has absolutely led to, oh gosh.
Throwing hands? Just kidding.
No.
Allie seems like a little crazy. She likes to fight.
No hands have been thrown, but it has been really difficult to talk about, and it is one of the reasons why we've sat on this topic for so long, and that is medical care.
Mm-hmm.
I mean, that's how it feels, though.
Mm-hmm.
It feels really, really heavy. I think it's
No pun intended.
important for us to say up front that our rules will be the same. We will not talk with specific numbers.
Because numbers are triggering, and we don't want any of you guys to be triggered by the fact that you're fucking super morbidly obese.
We are not giving medical advice. And we are going to just talk authentically about our experiences. But this is our safe space. And this is really important to talk about.
Yeah.
It is really important to talk about. It's also really scary to talk about. So, you know, we are taking a few deep breaths here in the studio. And
Every one of your breaths is deep because you have so much fat on your body that it makes it hard to breathe. And your lungs are working overtime. Oh my god, look at her eye. She like blinks one eye at a time. I've never seen another fucking human being do this.
keeping ourselves grounded, but it's scary to put yourself out here like this.
Yeah, keeping yourself grounded is probably very easy because you're super morbidly obese and gravity's a thing.
While we can also acknowledge that it is extremely necessary.
Yeah. I mean, I think for so many fat people, going to the doctor is scary on its own.
Yes.
Because your doctor is going to tell you to lose weight because you're super morbidly obese and not going to live another 20 years.
Because so much of our health is weaponized against us.
No, your weight just affects literally every aspect of your life, but you're in denial of that.
If we talk about anything that is deemed poor health, if we talk about anything that we're experiencing, it can often be turned towards us as a way to prove a point about our existence, about our health, about our bodies, about the way we care for ourselves, etc.
Well, whose fault is it? You're not a baby. Someone else isn't taking care of you. You are taking care of yourself, or you're actually just doing a piss poor job at it.
And what happens is it keeps health in a deep, dark, shameful closet that we do not feel empowered to talk about with our friends and loved ones and with professionals.
Yes.
And I think the only way out of it is to carve out spaces to talk about those things, to recognize that every single person and every single body type faces health issues.
True, but super morbidly obese people are more likely to have more health issues.
But they don't all experience the same reception of those health issues. And that is something we want to talk about from our perspectives as fat women. How's our health perceived? How are we given care? And how do we make sense of health as we navigate it all?
And I think as you were saying, everybody deals with medical, everybody, every shape, every size, every gender, every color, everything deals with health and medical issues. Also applies that everyone deserves
Healthcare.
Everyone deserves healthcare. Everyone deserves healthcare, and that's
Well, all three of you are a burden on the healthcare system.
that's a different topic too. But everyone deserves healthcare, but everyone deserves to feel heard.
Ooh, beautiful.
Within the healthcare system, everyone deserves
Compassionate
healthcare. Everyone deserves to feel like someone gives a shit about their health. If they give a shit about their health,
There's a difference between caring, like legitimately caring, and then damning someone for what you perceive their health to be, and damning them for what they look like. I think as fat people who are just out existing publicly, we often get told we're living wrong, we're taking care of our health wrong, we're doing X, Y, Z, based on a picture of us smiling at a movie. You know what I mean? Like,
But is that true, or is it a comment on one of your podcast episodes where you're fucking foaming at the mouth, drooling, talking about Thanksgiving dinner, but in the same breath then disowning your family members for talking about food? People are just pointing out the fact that you guys are all fucked in the head and you have problems with eating. It's not you smiling, doing a little outfit of the day. You guys don't just post cutesy little things. You post head-ass podcasts like this.
it could be literally anything, right? And so I think there is this line that people often make fuzzy of what does care look like, because for some people care is harsh truths, and I am putting that in air quotes because truths is not everyone agrees on what the truth is, and
Because you guys all deny science.
absolute just damning of someone to not live up to someone else's ideals of health. And
What she means to say is, someone loves me and wants me to be a healthy weight, but I'm addicted to eating Costco-sized jars of peanut M&Ms.
and I don't consider that care.
Yeah.
I also just want to I'm gonna let you go, Elizabeth, but I also just want to also preface this episode with
45 fucking disclaimers later, so absolutely no one gets offended.
we are fully aware of where some of this content is going to end up, and
On an anti-fat acceptance YouTube channel, perhaps?
honestly, we don't want to give those kind of people that much space. But for people who spend their entire days watching videos of fat people living in larger bodies, just so that they can make hateful reactionary commentary on them and then point the finger at us and say we're the problem.
Are they talking about me? Just kidding. This was posted like 10 minutes ago. Yeah, well, you are the fucking problem. You're the problem in your life, and then you're also a problem to society because you're encouraging. It's usually women that watch this shit, and it's usually women that are in fat acceptance. Then you're encouraging women to stay fat as fuck and not do anything about their life. So not only are you hurting yourself and your family members and your friends, you're hurting a lot of women.
What a sad life for you, sir. But what a sad.
I think my life is literally the opposite of sad. I was sad this morning because I just started thinking about my dog that passed away. I was like sobbing, but that's like a sad moment. That's not a sad life.
Sad life for you. So we are fully aware that our stories and our words here can get twisted and warped into it's our fault, right?
Well, whose fault is it? Who else made you 350 fucking pounds? Because God didn't. You came out your mom's vagina or stomach cavity, probably 10 pounds. You were a healthy, normal weight when you were just born. You got yourself to this place.
Air quotes. It can very easily get warped, and it will get warped, and we know exactly what channels it's going to show up on. And regardless of all of that,
You think they watch videos about themselves?
everybody deserves to be heard. So that's what we're doing here today.
Today we're going to be sharing some personal stories and experiences, and it is extremely vulnerable to do that. To summarize everything that my two lovely co-hosts said prior, it is you can be healthy and you can be unhealthy at any size. And today we are just...
No shit, Sherlock. But the fact of the matter is, if you're obese, you're more likely not as healthy. And most people are fucking overweight. 77% of the American population is overweight. I think it's actually 43. 43% of the US adult population is obese. 9% of the adult US population is super obese. A small sliver of the United States population is underweight. That's why we have an obesity epidemic. That's why we're talking about how unhealthy you are. Because your chin lays on your chest like this. If you showed up to a contest with fucking 25 different frogs to see who has the biggest chin like this, who can do the biggest ribbit, you would win. Because your chin sits on your chest, so we know you're unhealthy. I feel like I can't even breathe looking at her. Like, actors in fat suits do not even have this big of a fucking chin. Or second chin, I should say. Because she has a regular chin right here. And then her other chin is right down here at the bottom.
Talking about experiences, fat phobic experiences that we have had in medical treatment facilities. So,
fat phobic experiences, or your doctor just saying, hey bitch, you know how you have type 35 fucking diabetes? You should probably get that under control so I don't have to chop off your phalanges next Thursday because you're getting neurosis on your fucking toes. There's no circulation going to your fucking toes because you're not taking care of your diabetes.
Yeah, it's scary. We're gonna start jumping in here a little bit.
So when we were first thinking about this conversation, because we do plan for it to be a series, we're gonna have multiple episodes about being fat, health, healthcare advocacy, etc.
Yeah, every single one of your fucking episodes is about being fat.
We had a conversation that revealed that we were coming to this conversation from different standpoints, and that was a little bit tough. Okay?
Whoa, 3 people have 3 different perspectives. I thought you guys were all fucking zombie sheep in the fat acceptance community. You guys all had to have the same thoughts.
How do we see personal health? How do we see our role? How do we see what we owe to people or not? And what we realized in that moment was we didn't all perceive it or understand it or come to that conversation from the same viewpoint. And what we needed to figure out is, okay, well, how do we share this table? How do we come together? What are some of the things that do ground us, even if we have some differences? So we do want to explain kind of some of those thoughts because you yourself might have different thoughts about health.
6 minutes and 41 seconds of disclaimers. I'm not going to your Patreon.
I think it's not so much like we want to sit here and explain to you guys, but I think Alyssa and I just I don't know, let's have a conversation. You know, again, when we first started talking about this, and I know I brought this up in our introductory statements in this episode, but yes, health looks different to everybody, and I personally believe that no one owes health to anyone. We all have one life to live. We all have one life to live, and as soon as you figure out that you don't have to live it for anybody else, that's when it becomes the most fun, I think.
I think we owe our friends and family and people we love. Pablo and I are married now, till death do us apart. We plan on being together for the rest of our life. It would be extremely selfish of me to eat myself to being fucking 500 pounds, forcing him to take care of me, and then dying early. That would be so selfish of me. I promised my husband to live a very long life with him. And I have to be healthy to live a long life. That's just the fucking fact of the matter. Pablo and I don't have kids, and I don't plan on getting pregnant anytime soon, but like, I owe my future kids' health. I think it would make me kind of a crappy mom if I fucking died right after they were born because I didn't take care of myself.
But I think that because I am so passionate about, autonomy and agency and just, feeling as
Being able to eat myself to death, that's my freedom as an American.
empowered as you possibly can be, that has to apply across the board for me. So for me, that means I can't tell anybody what to do with their body, with their mental health, with their this, with their that. And sure, yeah, can I say going on a walk is good for your health? It's good for your mental health. It's good for your physical health. Yes, I can, right? But I also don't think that I need to tell anyone that they need to do that. I think it's also a matter of like, I think we often get infantilized, treated like children, kind of.
Yeah, because you don't know how to fucking take care of yourself. But also, everyone in the fat acceptance community fantilizes themselves and act like 400-pound babies because they never take accountability for anything.
And we, as in fat people, very often get talked to as if, oh, I've never heard, just eat less, run more, Oh, I've never
But people are trying to help out because you clearly need help.
heard, have you tried losing weight? Like, you don't need to hear from me, go take a walk. You don't need to hear from me.
Her chin is chinning too. Her chin is giving Alyssa's chin some run for its money. She might take second place in the Frog Chin Olympics. She's going for silver.
Drink some water for your mental health. We've all been in, very toxic diet culture for a very long time. I think
Toxic diet culture. No, just losing any sort of weight isn't fucking toxic. Is it toxic that I count my calories and try to get at least 7,000 steps in a day? Is that toxic diet culture? No, that's being fucking healthy. Diet culture is fad diets and quick fixes like your detox smoothies and appetite suppressant lollipops and Jenny Craig. That's diet culture. People are asking you to have 3 less snacks a day so you lose a little bit of fucking weight.
we all understand the basics of it at this point, and I just think that it can look so different to everybody what health means. So I'm never going to say you owe it to somebody to be.
There is a general consensus of what health could look like. But obviously, if you have a fucking disability or a certain disorder and disease that you were born with, or if you're chronically ill, like, yeah, of course, being healthy is going to look different to those people. But when you're able bodied, when you are born healthy, when you can do all of the things without any assistance, when you can function properly, then health kind of fucking looks the same for most people. You're not unique, you're not special, you're not different. I know your mom told you that so much growing up that you were a fucking special little snowflake and no one was as pretty as you and you're so special and unique. But you're just like everyone else here, basically, on this planet. Calories in, calories out. Get your fat ass off this chair. Stop filming this stupid podcast and go walk around the block. Stop getting double gulps from 7-Eleven of full sugar Cokes. You don't need it. Drink some fucking water. Get a Sprite Zero. You can implement small steps into your life to become healthier. We're not asking you to whip up a fucking concoction with cayenne pepper and honey and a dash of apple cider vinegar every morning. No. Just lose a little bit of weight. That's all people want. We want you to be healthy. But here you are making this podcast.
Be healthy. You owe it to somebody to be the best version of yourself, because I think you just owe it to yourself to be the happiest version of yourself and try.
And you are not the happiest version of yourself because you're obese. And when you are obese, you're more likely to have depression. And when you're obese, you also have more mental fog and you can't think clearly. And there's inflammation in your brain. So I know you're not happy. You may find temporary happiness in food, but you're not happy overall in the full scope of things.
Try to get there. And I know that that's not easy either, because I'm still working on being that person.
Yeah, we know you're unhappy.
And I think you and I, Alyssa, have very similar thoughts there, but also differ there too.
Yeah, I mean, I agree. I'm never going to tell someone that they need to do something for their health. So,
Yeah.
I will. Lose weight, bitch, watching this video. Or, bitch, if you're watching this and you're underweight, please go eat a meal. Or if you don't want to eat a meal, then have your meal replacement shake, please. If you're trying to maintain your weight because you've already lost weight or you've gained weight and now you're at a healthy weight, keep doing what you're doing.
I feel very, very strongly that the word health is really triggering because
It's a word. Sticks and stones may break my bones, but words will never hurt me. The word health is triggering to you because you don't take care of yours. You don't have health, you have unhealthy. You don't have healthcare providers, you have unhealth care providers because you don't do anything to take care of yourself.
someone that they need to do something for their health. So
Yeah.
I feel very, very strongly
She just blinked with one eye again.
that the word health is really triggering because of diet culture. I think
Diet culture teaches you how to lose 10 pounds in 3 days by giving yourself diarrhea. When you go to the doctor, they're most likely telling you to cut back on your fucking carbs and your sugars because you have type 325 diabetes.
health has been packaged to look a specific way, to perform a specific way, and I am actively flipping that off.
Does she think this looks healthy? Jamba from Lilo and Stitch, I'll say it again. Let me get that screenshot of her flipping off.
And I am actively flipping that off.
Come on. Fuck the haters. Period, girl. Period. I like her nails too. See, the sad thing is, Alyssa and I have a lot of the same interests. We like the same green. We have curly hair. We like purple. We like rings. But we can't be friends. Well, not only because I don't know where she lives. She probably wouldn't want to be friends with me anyway, but we just believe in different things. Fat acceptance really gets in the way.
Off. I think that is bullshit. I think health sometimes for someone can look like sleeping on the couch all day. I think for
Most likely not. Unless you fucking ran a marathon yesterday, which you most likely did not.
someone else, it could look like going to the gym in the morning. I think
Most people going to the gym in the morning would be considered doing something healthy.
for someone else, it could be eating a brownie for dessert that night.
Yeah.
Like, I think the word health has just been weaponized so much that in my journey and in my recovery, I think the most empowering
She's in recovery, in case you didn't know. She probably has a restrictive ED, just like Tess Holliday. That's why she has to be fucking 350 pounds. Because she's no longer restricting and she's just eating everything she fucking sees. She's on a seafood diet. She sees food and she eats it. And she's in recovery. So you cannot critique her at all because she is trying to recover. You hear that? When someone is in recovery, you cannot tell them anything. You cannot give them criticism, you cannot give them advice because they are in recovery. And if you say anything they disagree with, you will be to blame when they relapse.
thing that I've been given is to redefine what health means. So I very much think some days for my health, I'm taking a day off of work and I'm laying in bed. And I think some days for my health, I'm getting up from my desk in the middle of the workday and going to walk because
You should walk more often. I think like the average adult in America gets like 3,000 steps a day or something fucking insane like that.
I need some fresh air and to get outside. None of the way that I view the word health comes from diet culture anymore. For the same exact reason, I think you do owe yourself health because you do only get one life to live,
Then why aren't you taking care of yourself and your type 8 diabetes?
I think taking the time to redefine it for yourself and show up for yourself.
The thing is, like, they can't even define health anymore because they've made it this elusive, non-existent, nuanced concept. What is health then? Being rid of disease? No, you can be healthy and still have a disease. No. What is it? Is being healthy, being fucking 350 pounds? What is it? You can't even describe what it is anymore. These people in fat acceptance community can't even fucking define things anymore because they've twisted it and made their own definition, but also at the same time they can't even define it because there's so many whataboutisms in it.
Is so empowering. I do also feel like there's an aspect of owing it to the people who love you and you love to take care of yourself. I know that is tricky and that is icky and there is multiple levels to that. So
Let me add 7 disclaimers so no one gets mad, but someone will still be mad because Alyssa said one thing that they did not like.
I want to say that there's an access issue with that, right? Like some people don't have access to healthcare. I have seen some of my closest loved ones struggle so desperately and horribly with their mental health. And you can reach out a hand and you can want to help them, but you can't unless they want to help themselves, right?
Which is why no one in your family can reach out to you because you don't want to help yourself.
Right? So I think there is an aspect there of, gosh, do I know how hard it is to get out of bed some days,
Can't relate.
And I'm really thankful for the people in my life who can encourage me and support me and help get me there. And I don't want to give up. I want to show up for myself, and I want to show up for the people who love me. So while there's aspects to what you said that I absolutely agree with, I am never, ever, 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 ever telling someone what they have to do, because I don't know.
Yeah.
Yeah, but as a species, we're all pretty similar, and we know what's healthy and what's not. It's not healthy to only eat fucking chocolate bars for every single meal. It's not healthy to only drink alcohol and no other beverages. It's not healthy to walk 0 steps a day, but it's also not healthy to walk 50,000 steps every single day.
People did that to us, right? And that's where I know me and you will look at each other and be like, that's bullshit. We've listened. We've done what we're supposed to do, and it has harmed us. Supposed to. All air quotes.
What, lose weight? But you guys are all fucked in the head, so you didn't do it the healthy way? You just had a little BED cycle?
And it has caused us physical and mental and well-being harm. That's why I would never turn around
Well-being harm. Well, you're still harming yourself right now.
and cause that harm to someone else. I see you getting emotional.
Yeah, I just had a big realization. Go ahead.
I just want to encourage people to redefine that definition for themselves. And I feel strong about that because
My definition of health is spending all my money on DoorDash and clothes, and it's healthy for me to eat ice cream for dinner, and it's healthy for me to only drink Sprite Zero, and it's healthy for me never to work or never to take my dogs outside because it's healthy for me to play Fortnite all waking hours of the day. That's my definition of health. I will be putting that in the dictionary. I will be reaching out to Webster's very quickly. Make sure to pre-order the next dictionary so you can see my definition of health printed right there.
of the difference it has made for me in my life. Because fuck diet culture.
So I realized while you were saying all of that you and I are saying the exact same thing and have the exact same belief. Because I said in what I said before you started talking, I believe people owe themselves happiness because they have one life.
Yeah.
And happiness can look many different ways, right? I am still wrapped up in a version of if I tell someone that they owe their health, quotation marks, to themselves or to their families or to their loved ones, that means they have to be skinny.
No.
They tell on themselves. This is how fucking mentally ill they are. When I tell someone that they owe their family happiness and health, they have to be skinny. No. They could just be a healthy fucking weight. You don't need to look like fucking Gigi Hadid to be happy. You can look like a normal healthy weight person and be happy. That is health. You can do healthy things and be happy. You don't have to torture yourself to look like Gigi Hadid and be miserable. You can just be a normal weight. I shouldn't say normal because normal in America is fucking overweight, but you could just be within a healthy weight range, maybe slightly overweight, that'd be fine, but partake in healthy behaviors like eating a balanced diet, drinking enough water, exercising, crying, because her idea of happiness is skinny. Happiness is a state of being. It is a mindset. It is an emotion. It's not a weight. Even though we know you're unhappy at this weight because you're fucking obese and mentally ill.
I realize that. I realize that as you're saying that, right? Because I sat here and said, I believe that you owe yourself happiness. Because what else are we doing with this?
So in her head, she thinks, I owe myself skinniness. You owe yourself health, which is probably at least 100 pounds less than what you are now.
Life other than trying to be happy, right? But I realized while you were talking about that happiness looks different to everybody. Happiness may look like spending your entire day at the gym, and if that's what it is, then have fun, but if it's not,
they're all laughing because they couldn't imagine doing that because their happiness is going through the fucking drive-through all day.
You're not gonna fucking demonize me for it, right?
By the way, too, with that notion, right?
Yeah.
Happiness to me is not walking outside, but it was walking through the mall with my friends.
Yeah.
What's the difference?
She doesn't like walking outside. Who the fuck says that? Unless it's like 30 degrees or like 115. That's the only time that you're allowed to say you don't like to go outside. We need to go outside. We need to feel our feet on the ground. We need to smell the fresh air. We need to hug trees. We need to be grounded. We need to be mindful. We need to be grateful of our fucking beautiful trees and bushes and flowers that surround us. We need to get off our motherfucking phones. We need to touch grass, just like the kids are saying. We need to touch grass. Human beings need to go outside, and we should like going outside. You like to walk around the mall with your friends because there's a fucking Auntie Anne pretzels there. There is no Auntie Anne's in the forest, so that's probably why she doesn't like to go outside.
Yeah.
Happiness to me is not walking outside, but it was walking through the mall with my friends.
Yeah.
What's the difference?
Yeah.
Right?
That there's no Auntie Anne's pretzels in the forest.
I'm still moving my body. I'm doing something that I enjoy.
Yeah.
In all seriousness, like any form of movement is good. You can walk around the mall with all the fucking retired old farts in your area. Or you can walk around the block. They're both good forms of movement.
And I think the big thing that hit me is that, like, I keep thinking about my dad. And
in case you didn't watch the Thanksgiving episode, he is dead, and I think he was immobile. She didn't say how he died or like his situation, but I think he was humongous.
The big thing that hit me is that, like, I keep thinking about my dad. And how there was a big notion in my family. Everybody felt very comfortable talking about my dad and what he owed to his family, to himself.
Because he's a father and he's a husband. He should be the leader of the household. He should be taking care of his wife and his kids. He should be leading by example. He should be showing his kids healthy habits and healthy behavior so they grow up to be strong and healthy like him. But obviously he didn't do any of that because look at you, girl. I have a feeling that she followed into her dad's footsteps.
And that generally meant that he owed a smaller body. When
I have a feeling that her dad was like on fucking 600-pound life or something, the way that she's talked about him in the past. Yeah, because as a father, you should want to take care of yourself so you could be there for your children and your wife and your aunts and brothers and your cousins and your family members. I'm not sure how old she was when he died, but imagine if he died. I don't know. She has sisters, I think. So it's like, imagine if he died when all the kids were still minors. So then it's like, okay, he's not around to see them grow up, but he's also not there to take care of them. So then now his wife has to take care of all the kids by herself. Like, that fucking sucks, especially if it's something that could have been totally avoidable.
Now I think about my dad, the dad I didn't get to have, because what he really owed himself was happiness.
Which he clearly wasn't, because he ate himself to an early grave.
And I don't think he got a chance to explore what that meant to him because
body positivity and fat acceptance wasn't around then.
he just kept getting told that your happiness is dependent on living in a smaller body.
Yeah.
Your happiness was dependent on living on a smaller body. Well, your happiness is reliant on being fucking alive. And he's not.
And from medical providers, he was told that, from what you've shared.
Yeah.
Oh my God. Because he was probably super morbidly obese. So the doctor said, hey, you should fucking lose some weight or you're going to croak. And look what happened. He croaked because he didn't take care of himself. Allie talked about how her dad was immobile and people had to bring him food. At 450 fucking pounds, my dad was still walking around. My dad still worked fucking 450 pounds. Her dad must have been even bigger than that.
And that's why I feel so passionate about this conversation. I'm really
I'm sure if she could speak to her dad in the afterlife, he would tell her, girl, get your health under control. Girl, lose some weight. Girl, go see a fucking therapist. Eating is not worth it. Take care of yourself. You are worthy of health. You are worthy of taking care of yourself. You are strong enough to do the hard and difficult things that you need to succeed.
held tight on the health part, right? It's that word. It's so loaded. And you both have taught me what do you mean by that?
Yeah, I mean, that's what my thought is. Like, there's two things you said that if you had not done your explanation ahead of time, would have triggered me. Right?
Yeah.
First being owing health.
Mm-hmm.
The second being giving up. And that's because those two phrases
Yes.
are weaponized against
Yes.
everybody, really, but especially fat people, right? And so when I hear don't give up, or I shouldn't give up on myself. I shouldn't do that in a health context for so many people that's stopping dieting.
Yes.
And so therefore we're giving up if we stop dieting,
Correct.
right?
You shouldn't be dieting. You should be making healthy lifestyle changes so you can have sustainable weight loss.
And so when you're going around and we're talking in a general public sense, or even with friends who haven't taken the time to be like, well, what does health mean to you, right? It could be very easily.
Because everyone that's not fucking chronically in line, like people in the fat acceptance community, don't need to sit there and ponder what health is because they know what it is. They're not making up a fake definition so they can coddle themselves and sit down and eat a fucking family-sized bag of Doritos and not feel guilty.
Triggering. Those phrases, it's almost like we need a whole new language to talk about it outside of that system.
Yeah. Yeah, Allie, I want to hold some space. No, please do not apologize. We can either hold space not recording or while we are recording, but I do want to hold space for what's coming up because it's so heavy.
I just, it's no secret to you guys. I have a lot of regrets when it comes to my dad. And obviously with, him not being here, there's nothing I can do about them, right? But there's just so many layers to him and who he was that I only get to learn and process now that he's gone. And that's really hard. It's really hard because
I mean, like, I'm really fucking sad for her. Like, I'm devastated. Wouldn't you think that seeing your parent struggle with something would make you not want to do the same thing? People are like, your dad caught a stray in this video. And I'm like, bitch, she catches a fucking stray in every video. But like, my dad is an alcoholic. I didn't even have to do any of the same things he did to learn a lesson from his behavior. I will never be an alcoholic because I've seen how fucking horrible it was for not just him, me, my sisters, my mom, who was once his wife, now his ex-wife, his parents, his siblings, his cousins, his coworkers, his belated wife, and now his current wife. So I know I don't want to be a fucking alcoholic because I've seen how horrible it is. And then I've also seen my dad be 450 pounds. So I don't want to be that super morbidly obese because I know how horrible it is. But I guess some people just can't learn through other people's experiences. Like, they have to find out the fucking hard way and deal with it themselves. And I'm sure there's some sort of trauma that's wrapped in with her weight, as there is most of us with our weight. But it's like, if you saw your dad struggle so bad with his weight, wouldn't you want to take preventative action? Or like, if you saw him struggle so bad, why do you want to experience the same things that he did? While they're sitting there pondering the definition of health, these are the things that I ponder.
Know any of this, I didn't know any of this when I still had him. And I wish I did. I wish I did, because there were times in my life where I was mad at him because he wasn't pursuing quote unquote health in the way that I was taught health.
Him probably needing to lose weight.
Health was supposed to look like.
You can't punish yourself for that. You can't punish yourself. This is
I mean, at the end of the day, it's like her dad's fault. But I understand that people feel guilty after people pass away because they feel like they should have done something.
Honestly, copy and paste the same stuff I tell my parents. My parents did the best that they could with the information they had available. They didn't know that they were encouraging me to have an eating disorder. They didn't know that.
Yeah.
Right? This is why it's so important to talk about, because it's not what's being packaged and delivered.
Yeah.
Yeah,
You're not going to health at every size your way out of this.
I feel for you, because it can feel really
sad, frustrating.
It's really sad and frustrating. You're empowered in one sense, but you can't change this thing, right? I am proud of you for taking the empowered stance you have now, the
I'm proud of you for feeling proud of being proud.
views you have now, and at least communicating with other people and approaching the people who are in your life currently with those views and with that compassion, right? We can't go back in time and know what we know now. That's like that scenario of like, can you go back to high school being an adult that knows what you know now? It's a movie.
I wish I could.
It's a movie, Yeah. We don't get to play out that storyline. But let me tell you, as much as that learning may not have helped him, I am sure that there is something about a legacy of his story helping you with yours. Seeing
is help in the room with us.
What happened with him and changing it for yourself, right?
That was really beautiful.
And what a gift to get from learning from your dad.
Yeah, my dad was just a really special person, and he did have mental health issues. that I do wish he had put some time into. But no, I don't think he didn't. I don't think he owed them to me. But
She said in the Thanksgiving episode that she has borderline personality disorder. When you have BPD, you have a lot of trauma. So I can only imagine the things that went on in her household.
my dad was a special person that it just hurts. It hurts because he was a special person that was only seen for his size.
Mm-hmm.
So he's probably pretty big.
And he was so much more than that.
We are all so much more than that.
I mean, I hate to segue. We don't have to segue.
No, we can say that for
But
sure.
The whole being seen as just your size is why medical professionals are so hard to go talk to, because it's hard to find a medical professional who wants and takes the time to see the whole picture.
When the whole picture is 600 fucking pounds, doctors know what's going on. They just sound so fucking ignorant. Okay, I'm assuming makes an ass out of you and me, whatever, but 2 + 2 is 4. Ellie literally has trauma because her dad died young and her dad wasn't there for her very long. I'm assuming he had to be fucking massive because of the way that she described him. And then for them to be like, well, doctors just don't see the whole picture. Like they're so close, but yet so fucking far away. Allie's dad literally died because he was so big. Not one of the 3 of them realized that weight affects their fucking health. Just because they're not as humongous as Allie's dad was, doesn't mean that their weight won't affect them or catch up to them. And if your doctor is telling you to lose weight every time you go to the motherfucking doctor's office, then you should probably lose weight. Your weight affects your health. Diabetes, stroke, lung capacity, knees, joints, heart, mental health, bone density, GI issues, cancer. Like the list goes on and fucking on and on and on and on and on. Like hundreds of reasons why being obese is bad for you. You don't have to be 600 pounds for it to be bad. You could just be 250 and it start to affect you. You could just be 175. You could be 175 pounds and your weight start to affect your life. You don't have to wait till you're fucking 500 pounds. I'm flabbergasted.
Doesn't just look at the weight and say XYZ, or even finding a doctor who doesn't look at weight as meaning one thing. Like
when you're so motherfucking fat, you can't even see your BMI on the general scale because it's at 90, then we know what's going on with your weight. You fucking eat too much.
you could get doctors who maybe won't say anything, but they're not looking at weight as a complex situation, And so, like, navigating situations where you are going in with the possibility, with a very high likelihood of being seen only for your size, and having to advocate for yourself and having to mentally prepare for it, having to deal with misdiagnosis or bad medical care in the process is a humongous task.
Humongous task. Thank you, Rebecca. Let's put it on replay.
Humongous task.
Humongous task.
That prevents fat people from seeking out professional help to begin with, but also means that the professional help they get isn't always up to standard.
Fat people don't go to the doctor because they don't want to hear that they need to lose weight, because they don't want to lose weight, because they love food. They love food more than they love themselves. It's not because of weight bias and discrimination. It's because they don't want to hear that they need to lose weight. They don't want to hear that their weight is affecting their health. They don't want to hear the motherfucking truth. They want to walk out of the doctor's office with a lollipop and a sticker like they're 6 years old, but instead they get a referral to 6 different specialists because they have a laundry list of new diagnoses because they won't do as they're told.
That leads me directly into the first question I wanted to ask today.
Okay.
Which is, I feel like sometimes online we see the stories from folks in larger bodies being like, oh, I went for knee pain and I was prescribed weight loss.
Mm-hmm.
Because you're so fat, your knees have turned into dust.
What is your personal most blind side of a weight loss diagnosis. I don't know what word we want to use there. Prescription, excuse me. Prescription, I think, is the right word. When were you most caught off guard by a weight loss prescription from a doctor?
How often do you guys go to the fucking doctor? Like, I only go to the doctor when I'm sick or like it's my yearly checkup. Maybe I go to urgent care once a year, and then because my doctor gave me a referral to a vascular specialist for my varicose vein, then I've gone to like 2 appointments for that. But before then, I only went like maybe once a year, and then maybe like once to urgent care a year.
Interesting. So I thought you were going somewhere differently at first. I thought you were going like to a place where our weight meant they changed the way we were treated, and definitely have something for that.
Oh,
I like this angle.
I would say, I mean, probably the one that shocked me most is just because I was a teenager. So I was in high school, and going to my family physician I had seen for forever. I was probably pretty young, probably before driving age. I don't know what I was going there for. If I were to guess, potentially heavy periods.
okay.
Or maybe like a yearly checkup for vaccines or something.
That's my first thought. And the doctor very casually said, well, have you thought about having weight loss surgery? And
Oh, wait,
yeah.
right to surgery.
Yeah.
That's going to be on the cover of That Never Happened magazine next week. Weight loss surgery is so extreme, especially for a child. There had to be many conversations about weight before then.
And so, well, that doctor had also put me on phentermine, which gave
So this woman has had problems with her weight her entire life. And I would argue probably pretty extreme problems with her weight if she was prescribed weight loss medication as a teenager.
me heart palpitations and such. So she had given me a pill form to make me lose weight before then. But I think I was, this was pretty early on. My aunt had weight loss surgery already at the time, but she was one of the very early people to have it. And it seemed like such a scary thing. And not to say that it's not scary now, but being decades into people having this surgery feels very different than being like 1 to 2 years to it becoming a popular surgery.
Yeah.
And I would say as an adult, I was also told to have weight loss surgery.
She said in the Thanksgiving episode that she tried to get weight loss in her mid-20s, but she was declined because she failed her mental health evaluation. And then I think 2 or 3 years ago, she finally got the weight loss surgery, but we see how that went. That weight loss attempt was obviously failed because she's still fucking super morbidly obese and now has a fat acceptance podcast.
Then I asked her, because at that point in time I had already looked into it a couple times, and I was like, okay, but I don't qualify in XYZ ways, and she had no idea any of that. So I was like, okay, so you just saw fat equals, say, weight loss surgery. She didn't actually know anything about weight loss surgery. And
Unfucking believable. If the doctor didn't know jack shit about weight loss surgery, then why are they prescribing it to you?
as soon as I asked her a couple questions, I was like, got it, understood.
That's super fucking frustrating. I think mine actually was very recent, and you guys were both a part of this time in my life. It was after my dad passed away. It was after, I left my marriage. I was just not in a good place.
So he died pretty recently, maybe? And she's divorced.
And I was very quickly and unexplicably losing weight. And not just losing weight, I was losing my hair. I was very drastically seeing changes in my body that I was unintentionally, I was not.
Well, she might have lost hair because she was so fucking stressed out. I wonder how much weight she accidentally lost, because she probably gained it back.
Doing any of it intentionally. There was no dieting. There was no, I wasn't doing anything to make any of that happen. And so a couple of times I got really sick, and every doctor that I went to, I'm like, hey, this is really concerning me. Every single one. Congratulations. I'm sick, doc. I'm sick. I feel fucking terrible. I feel like I'm on the verge of passing out every morning. Every time I come in here, I'm another handful of pounds down, and my hair keeps fucking falling out, and you're telling me congratulations. So that to me,
I feel like there's some missing parts of the story, because every one of them is a poor narrator.
told me all you see is just, as long as I'm smaller, it's a win.
Yeah.
And that felt the most invalidating out of.
I mean, at a certain point, kind of, like, it's better to be fucking 300 pounds than 350.
Because I've had the doctors who were like, oh, your stomach hurts, lose weight. Like, oh, your head hurts, lose weight. And all of those got trumped by the, hey, I think there's something wrong with me. Congratulations.
I'm just trying to imagine going to a dentist like, hey, this tooth is turning a different color, and they're like, well, I like the decoration of it. Let's look at your other teeth.
Right?
Like they get to decide if it's a good or bad thing, regardless of you coming in to address that thing.
Exactly.
Yeah.
Exactly.
I'm embarrassed to admit mine
Don't be.
because it feels very shameful. I was in high school, and I have these like little bumps on my arms, like up at the top. It's really common apparently.
How do you do?
Okay, I wanted to do something about it at the time. I don't know. I just wanted to. And I went to a dermatologist. I've not been to a dermatologist since this experience. But I went in and she never asked me why I was there. She went straight to the acne on my face. She went, great, let's do something about this. And
Again, I just like can't believe anything they say.
she never asked me why I was there. She went straight to the acne on my face.
Well, she probably just was using context clues. Oh, you're sitting in my office and you have a bunch of fucking zits. That's probably what you want to talk about, especially if you're a teenager, because a lot of teenagers have really bad acne.
She went, great, let's do something about this. And then she went and then she like finished up telling me all about my skincare, my face. And she went, great, so what are we doing about the weight?
Well, at the end of the day, dermatologists are fucking doctors too. I mean, yeah, sure, they don't practice like family medicine and stuff, but they still went to school and they know that if you're overweight, you probably eat like shit, and your skin often reflects what's going on in the inside. So if you're eating like shit and you keep gaining weight, and if you're eating horrible food, it might also give you acne.
I was so unbelievably embarrassed. My mom was there in the room and like just literally, completely froze. And truly, I like have wanted to go to a dermatologist since. I've been told that I should like go get my skin checked out and stuff, and I literally cannot get myself to go. I scheduled an appointment, I canceled it because it's just like I was so. I feel like there's an aspect of like as a fat person.
Do you think they actually mentioned her weight, or do you think the doctor asked about her diet?
When you're going to the doctor, you like prepare yourself.
You do.
Right? You're like ready for it. You like you know how you want to answer the questions at some point. Like you're like,
This is like preparing all of the fucking arguments and comebacks that they're gonna say before Thanksgiving. If you weren't super morbidly obese, then you wouldn't have to prepare for comebacks about your weight when someone expresses concern. If you were a healthy weight, then no one would even comment on your health or your weight. Yeah, I'm sure that there's some fucking assholes that could squeeze your little fat roll because you gained 5 pounds. But it's like all of these issues would go away if you lost weight. I'm not saying like that's an excuse for medical mistreatment. There are some things in your control, and of course, you're not going to take any accountability for that.
I'm ready to go, and I just was not ready, and it landed so aggressively. Like I literally was there for bumps on my arms, and we never even talked about it.
Well, I think that's
Things that never happened for 500, please.
just so indicative of exactly what we're talking about, right? It's I told the doctor I had knee pain and they prescribed weight loss, right?
Yeah.
Maybe because your weight has caused your knee pain. Ever think about that? No, doctor's just being fat phobic, right?
It's constantly being invalidated. It's constantly being unseen, unheard, and saying, hey,
I think it'd be pretty hard to not see you.
I also deserve medical care for the things that I care about without you taking one look at me and thinking weight loss is going to solve all of my problems.
Yeah.
Why should a doctor care for you if you don't care for yourself? Doctors can only do so much. Doctors can prescribe you pills and give you procedures and recommend you for therapy. But at the end of the day, your lifestyle choices affect your health. If you have a fatty liver because you're an alcoholic, the prescription medication your doctor gave you can only help so much. Putting the drinks down would also help improve your life. The medication isn't a miracle worker. Same thing goes for smoking and breathing problems or lung cancer. Same thing goes for being fat and knee and joint pain. Like, doctors aren't fucking miracle workers. They just have a degree in medicine.
Because it's not.
Yeah.
It's just, and that, again, I'm not a doctor, I'm not giving medical advice, but it's just not. And
Exactly, you're not a fucking doctor, so why should we believe what you have to say over a licensed physician?
that's a fact.
Well, what it shows is that your doctor's approach alone can alter your health journey.
Yes.
I'm curious about like a situation with Dr. where you feel like they did alter your health journey in some kind of way. For me, one of the biggest health issues I found until I got an IUD. An IUD, bless you, IUD. Honestly, an IUD has changed my life, okay? As I've always had period issues. Very heavy periods, no periods for months, heavy periods.
Sounds like she has PCOS or like endometriosis. I'm totally fucking saying that wrong. But what you eat can also make both of those disorders better or worse. Your weight can also make those disorders better or worse.
Was going through a situation where I was having really heavy periods that were unending, like 3-month-long period, etc. I went in to see my doctor. I was bouncing around different family doctors at the time, and
I was looking for doctors to give me the answer that I wanted, but no one was, so I was doctor shopping. Yes, I will admit that.
And my doctor happened to be gone. I saw another doctor who was relatively young and a man, and not that
So he was probably taught health at every size. Great.
that really gives him any leeway, but I went in, I was like, okay, I was prescribed these birth control pills, but I'm still experiencing XYZ, and he's like, and I was like, I don't know if it has something to do with my body size. I immediately put it on my body size. I was like, I don't know if this has something to do with my body size.
Yes. The answer is yes.
I don't know if that means the dosage needs to go up. That's literally what I said, not knowing anything about anything. And he's like, oh, that might be right. What if you double your dose?
Because you're twice the size as a healthy weight woman.
And decided to have me double my birth control dose. That's not.
I didn't even know that there was different dosages of birth control. I just thought it was like one regular pill. Shows what I know about the fucking medication I've been putting in my body for 15 years.
What should happen? You are probably just having the wrong hormone in your body. This made the lining in my uterus get so big and be so hard and painful to pass that I had to have a DNC to remove the lining of my uterus, which is the blood lining. DNCs are often what's performed after you can't successfully hold a baby, things like that. It's clearing out your uterus. And I was young enough
But the whole time she's been talking about this, it hasn't been about weight, but maybe she's showing an example of a doctor like not talking about her weight.
at that point in time that I never said anything to anyone. I just assumed it was my fault. Never said, hey, this person put me on a medical plan that harmed me, that made me lose so much blood I had to get infusions, that made me have to pay and have a DNC process.
Because you were scared to go to the fucking doctor and get more help. I mean, it is your fault at the end of the day because you weren't seeking out more medical treatment.
That's one of the things, like, now at my age, at the wise old age of almost 37, like, I am going to tell on you. If you are a medical person who
So Rebecca is a Karen.
harms me, I will be reporting you. But back then,
If you tell me to lose weight, I will get you fired. Don't you worry about it, sweaty.
my fault. My fault. So I am curious. It doesn't necessarily have to be negative. Have you had a medical professional that changed the direction of your health journey?
I did.
And I will say, after that, I met another male gynecologist. I switched to another gynecologist, and he said something that made a lot of sense. He said, when you have fat in your body, fat cells actually create testosterone. And so what
All right, so this doctor is going to educate her a little bit more about fat and the consequences of being fat.
you need to balance your system is progesterone. You should have never been on birth control. You should have been on this progesterone hormone. And they have a birth control version of that, and they have just a hormone version of that. As soon as I went on progesterone, I had normal periods for years.
Adipose tissue creates estrogen, not testosterone. Muscle creates testosterone. No, fat tissue does not produce testosterone. Rather, excess body fat is linked to lower testosterone because fat cells convert testosterone into estrogen, which in turn signals the brain to reduce testosterone production. However, dietary fat is essential for testosterone production, and studies have shown that high-fat diets can maintain or increase testosterone levels, while low-fat diets can increase them. This lady, literally doesn't even know what the fuck she's talking about. She has a bunch of extra estrogen because she's super morbidly obese. And I know they did 75 different fucking disclaimers saying that they're not medical professionals, but people listening to this podcast are still gonna have little seeds planted in their brain. If she had more testosterone, then it'd be easier for her to lose weight and gain muscle.
Hormone version of that. As soon as I went on progesterone, I had normal periods for years.
How incredibly frustrating that the answer was so simple.
Yeah. Yeah.
Oh.
And literally just because at the time I wasn't having sex, I didn't care to have birth control. I just stayed on progesterone hormones, and it affected my mood. It affected everything.
I always pause her at such horrible times. Having hormone imbalance affects your mood. No shit, Sherlock. Do you know what else would balance your hormones? Losing weight.
I'm not saying this because I think it's going to be groundbreaking. I'm saying this because my dad said it to me, and it was groundbreaking for me. And my dad looked at me one time and he goes, somewhere out there is the world's worst doctor. And I was like...
And what are the chances that all three of you have the most ignorant, fat-phobic, worst doctors in the whole world? Very slim chances, but somehow it happened.
Damn, you're so right. Just because they're a doctor does not mean that they know everything.
And somehow you have Google and you know nothing.
And it made me feel empowered to start questioning some things.
Yeah.
I mean, if you want to take that even further, those are usually the doctors at insurance companies are calling up to say, hey, do we have a valid reason to deny this claim? And they send the file to that doctor, the doctor that has never seen the patient, never put hands on the patient, to say, yeah, absolutely, because of this. And it's usually...
What? Literally what? Most doctors would like their patients to seek the correct treatment. They don't just help insurance companies deny a bunch of fucking claims.
that kind of doctor. So, yeah, your dad's right. And also, isn't it wild? Isn't it fucking wild? God, I'm mad now. Isn't it wild? I'm sorry, this doctor basically forced you to have an abortion.
What? There was no baby. Yeah, that's why I was like looking up, I'm like, what is a DMC procedure? Because I've never heard of that. This is Google AI, so whatever. But it said, remove tissue from the uterus after having a miscarriage or abortion. To remove polyps from the uterine lining. Diagnose or treat bleeding after menopause. Diagnose or treat heavy or unusual urine bleeding. Diagnose conditions when unusual endometrial cells are found in urine during routine testing. That's not an abortion. That's getting your fucking insides scraped out. Like, these people literally don't know what the fuck they're talking about.
Isn't it wild?
There's no baby.
I'm sorry, I know, but it's just, I go to extremes.
What? Like, you leave me speechless, Allie.
Isn't it wild that the second doctor took 2 seconds to instead say, instead of,
Well, she probably would have needed to get that procedure anyway if there's, like, a thick-ass fucking lining in her uterus. I don't think that would just go away if she got put on the right prescription.
You're fat, so we're gonna have to, just, I don't know, let's fuck some shit up, to just go, okay, you have extra fat on your body, so here's the solution that has nothing to do with your...
You have twice the amount of adipose tissue as a healthy weight woman, so let's double your birth control and then try to balance your hormones because your fucking estrogen is off the charts.
With you being whatever, I'm angry.
Literally, and the second doctor, literally nothing was judgmental, nothing was any of that. He's like, you need this. If your body the way it is, you need this.
He literally was just
Thank you, sir. That's what I need.
X plus Y equals Z, and this is what you need. Like, that's it. And the other guy's like, oh, I don't fucking know, just double it.
And I'm like,
bro,
I think it's because I suggested it. I suggested, like, is it a dosage thing? I'm like, you made a medical decision off of a 22, 23-year-old saying maybe it's a dosage issue because I just assumed my body's bigger.
So a 22, 23-year-old who, no offense, never went to medical school?
No.
Okay, cool. Oh, all right, well, I'm angry, and I'm already angry, so let's get on to my guy. He's still very much practicing here in Charlotte. He's a urologist.
Oh, yeah, they're from, like, South Carolina or something, right? Or is it North Carolina? I think it's North Carolina.
And I'm going to preface this with, and I know I don't need to explain this or anything, but I have always had urology issues. I've always had kidney issues. I was born with a deformed kidney. It looked like a cat's paw. They're supposed to look like kidney beans. And also, I have an extra large bladder. These two can pee 10 times a day. And meanwhile, I'm like, I'm good, you guys. I'm fucking good. Because...
So you were born with a birth defect, and you're not doing anything to prevent that from getting any worse.
Normally a bladder's the size of a golf ball, mine's the size of a softball, so now you know more about me than you ever needed to. But I digress.
That Alex
Literally
told this.
yesterday, I'm like,
No, I was gonna say it too.
I was like, what's wrong with y'all? I've gone to the bathroom twice since we've been together.
Stop bladder shaming me.
I went once.
I didn't realize you had gone, but I often worry about Allie. I'm like, how have I peed this many times and you haven't gone at all?
Because I have a superpower.
Okay.
I just got a big ass bladder. I got a big ass bladder.
You got a big ass a lot of things, but not a big ass brain.
Anyway, so I've always had these issues. It is not because I'm fat, but I've always had these issues.
But being fat makes it worse.
And since I was a little kid, I literally had like major reconstructive surgeries in 4th and 5th grade. I was like homebound for most of 4th and 5th grade because I was recovering from these surgeries. Like I've always had these issues.
Like, why is she talking like she's so excited? Like she's like flexing on us or something. Or she's gonna be like, told you so, bitch. Like, whenever I talk about my health stuff, I'm like, it was really scary.
But it wasn't until 2021, I believe, that I had my very first kidney stone. And it was fucking so painful, absolutely so painful. I did find out later that actually a medication that my previous doctor had put me on that was quote unquote supposed to help me with some mental health stuff, I also found out was kind of covertly supposed to do a little bit of weight loss magic. I wasn't
Wellbutrin, I bet, even though Wellbutrin won't make you fucking lose weight.
aware of. Can also lead to, helping you develop kidney stones. I digress.
I'm sure being super morbidly obese also helps you develop kidney stones, but
Yes, obesity increases the risk of kidney stones. Who would have thought?
let's not take that into consideration. Let's just blame the doctor and your medication instead of the food that you engulf on a probably hourly basis.
Go in because I have this kidney stone. I went to the ER and they're like, oh no, you have a massive fucking kidney stone and we could let you pass it, but that would honestly be irresponsible of us. So we need you to go and get it taken out. So they refer me to this guy. I go and see him and he's like, no, we're going to take it out this afternoon. And I told this man I've taken AZO. It is, they make a lot of different products, but they make.
So she is a UTI as well as a large kidney stone, which I think obese people are also more prone to getting UTIs as well.
Reason 31,469 why it's bad to be obese.
I'm starting to just come up with an extra long laundry list of reasons why being obese is bad.
Like when you have a bladder infection, like urinary tract infection, they make a pill that makes it hurt less, right? But it also turns your fucking everything in there fucking like red, like this bright orange red shit. Like it looks kind of crazy, okay?
Yeah, we're mostly women. We've all fucking taken it before.
I told this man that. I told him that. I go in for surgery that afternoon, and it was unsuccessful. They could not get it out. And the AZO thing comes back later. But the first thing this motherfucker does when I wake up in recovery is say, you need to lose weight because we had a hard time regulating your anesthesia or regulating your breathing under anesthesia.
Yeah, because guess what? Add that to the fucking list. Tick. It's also more dangerous for fat people to go under anesthesia because it slows down your breathing and your heart. And when you're fat, you have a lot of issues with those things already. And you're more likely to croak under anesthesia if you're fat. Sometimes if you're so fat, you can't even go under anesthesia because it's such a risk.
And then proceeds to tell me that, oh, also we couldn't get that kidney stone in there because it looked like you had an entire bottle of fucking Orange Crush up there. Sir, I told you that I took AZO, number one. Number two, you fucked it up. And less than 24 hours later, I was back in the emergency room in septic shock. Because
Yeah, it's all the doctor's fault. Nothing you did, right?
not only did he not get it out, but he dislodged it. And so in dislodging it, all of the shit that had been like behind the kidney stone as it was building, it was like there was bacteria and shit went into my bloodstream and I literally was dying. I was in the hospital for 5 fucking days. All right. So they did finally get it out. But yeah, the first thing that this man tells me upon waking up is not, hey, I'm so sorry, it wasn't successful. Hey, how you doing? Nothing. You need to lose weight because we had a hard time.
Not this week, not next week, but the week after that. This story will be on the cover of This Never Happened magazine. I mean, I've only gotten surgery once, but like, I don't even remember what the fucking nurses said to me when I just got out of surgery. I fractured my wrist. I barely remember making it to my apartment. I mean, obviously, Pablo like was there and he brought me home, but like, who the fuck remembers exactly what was said to them when they woke up from anesthesia? You're like out of it for a while.
Doing our job. Sir, I told you the information that you needed to know. And also, if like, I don't
I mean, I don't know how like a kidney stone is taken out. Like, I don't know if they do like a little incision on your stomach or something, but yeah, being fucking super morbidly obese probably makes it really hard for the doctors to get in there because they gotta maneuver around a bunch of blubber.
Anyway, I digress. So what did I do after that? I decided that was all of my fault. I called up this person I knew who was like a personal trainer and all this other shit. And I told this person, look, I am not going to be successful with like a majorly restrictive, like completely upending my life kind of thing. And what did she do? Put me on a completely restrictive, upending my life kind of thing. We're like, oh no, just swap out your coffee for mushrooms. Like just the fucking weirdest kind of shit. And like,
why did you take that advice from a personal trainer though? Personal trainers should show you how to fucking exercise. I mean, maybe they can give you some health advice, but like go to a nutritionist or like a dietitian or just like cut back on the fucking Culver's triple butter burgers, girl.
Like I'm supposed to be drinking this clear broth stuff, like very restrictive diet kind of thing. And I was paying like a lot of fucking money for this, a lot of money. But yeah, I basically decided it was all my fault that I almost died because this man.
Well, it is your fault you almost died because you don't take care of yourself. Because I bet she probably had a lot of kidney pain up until that point, but she never took care of it.
And she literally has a deformed kidney from a birth defect ... If you have a messed up organ or a disorder or disease, you should try to manage it through healthy lifestyle choices. She needs to grow up and take care of yourself instead of blaming the doctors for her poor health.
Said that to me. Yeah.
I can go two ways. I can go negative because it was bad, and I can also go positive. So, do we have a preference?
I feel like you're going to talk about Dr. Everett.
Of course.
Let's talk about Dr. Everett.
Yeah, I started therapy with Katie in October of 2020. And gosh, sometimes when you just find the right person, you just know it. She asked all the right questions. She knew not to take certain answers. She knew when to she just was it for me. Like, she just was able to... I think what was so beautiful was I wasn't ready really to talk about a lot, and she got the context without triggering me, without pushing too much. And, you know, at one point I started talking to Katie about my relationship with food and my body, and
what's so crazy is, like, you can see where her chin is and, like, where her bones probably are. And it's like, all of this right here is just fucking fat. Like, this is her chin, and this is where her jaw line, and this is where her jaw is. And all of this is just fat storage because she eats way over her calorie maintenance. All right, let's hear what your health at every size therapist said.
And I don't know, for me, it wasn't like talking about it like it was a problem. It was like an offhanded comment. And she very much had to look at me and be like, you know, that's not normal. And I was like, no, girl, it totally is. You're just skinny. Like, you don't get it. Like, what? Like, yeah, it's normal. It's normal. And she...
Yeah, it is normal to sit down and eat 3 quarts of ice cream after dinner. You're just skinny. You've never done it.
Was like, hey, I really think you need to go talk to my friend Taryn. And I was like, oh, I don't want to do another diet right now. I'm so frustrated. Like, I had just come off of my negative story. It got me to a place of one of the absolute worst, most restrictive places of my eating disorder I had been in. And I had just started to come out of that a little bit. And like, hey, the brain fog clears a little bit. And, you know.
What do we think the restriction was? Having 2,500 calories a day?
Oh, like, you're just like, wow, I was feeling really shitty. So I just was like, no. And I think I've shared before that I am the type of person that if you just keep pestering me, I will do it to get you to shut the fuck up. No, literally, take notes, girl. If I don't want to do something and you just continue to, I will do it to get you to shut up.
That's how you get her to Venmo you for coffee.
Oh my.
I'm gonna tell her once. I just told Venmo twice, but I told you once.
Thank you.
Told you.
Record. Oh my God. So I go see Taryn, and
literally snarling.
Taryn is the person to pretty much be like, yeah, there's something going on here.
So is she a dietitian, maybe?
And Taryn gets me connected with the one and the only Dr. Vanessa Everett. I'm gonna cry. I am gonna cry, but
So Dr. Everett's probably a fucking Hayes doctor.
Dr. Everett is one of a kind. And she truly takes care of her people from the appointment all the way through. And the nursing staff is so good. I've never been able to walk into a doctor's office and have my blood pressure taken and it be accurate because I'm sitting there trying to not have a panic attack, you know? And then they want to use that number to like, I'm like, oh my God, I promise you I go. I literally.
You shouldn't be having a fucking panic attack because you're having your blood pressure measured. If you're that nervous, it's because you have a fucking guilty conscience.
Go as far to go to the firehouse where I feel more safe because my husband is there, and have my husband take my blood pressure so that I can tell people that I don't have blood pressure issues, because I go to the doctor's office and I just want to hyperventilate. Like, my whole body is freaking out. White coat.
Does she have doctor phobia or something? Like, no one should be tweaking the fuck out this hard.
Issues, because I go to the doctor's office and I just want to hyperventilate. Like, my whole body is freaking out. White coat syndrome is so real for me.
White coat syndrome? All right, teaching me new stupid fucking words. White coat syndrome is when a person's blood pressure is high in a doctor's office but normal at other times, caused by anxiety or stress in a medical setting. Unless you have medical trauma, like actual medical trauma, not just being fat as fuck and not wanting to go to the doctor, unless you have like actual medical trauma, no one should be experiencing this. She has white coat syndrome because she doesn't want her doctor to mention how fucking super morbidly obese she is.
And man, oh man, I've been seeing Dr. Everett now for 3 years, and
how's that health journey going? Not looking too good in my opinion.
Every single appointment heals a different part of me, and I don't think she knows how amazing she is. And
is this doctor running a fucking cult? I've never seen someone cherish a doctor like this before.
That makes her even more amazing. You know, like, she's just doing her job, and I tell everyone to go and see her because I truly, like, oh, the staff is so good.
Yeah.
The staff is so good.
Yeah.
Dr. Everett is one of the first doctors to look at my blood work and say, you need to eat more.
Yeah, maybe eat more fucking vegetables. Is Dr. Everett a fucking feeder? Like, what? Her doctor said that. Not this week, not next week, the week after that. This story will be on the cover of This Never Happened magazine. Oh, these women crack me the fuck up.
She looked at my blood work and said,
she is like in tears, so happy. She is jolly, filled with joy. So happy that someone told her that she needs to eat more. The first person ever in her entire fucking life telling her to eat more, because quite frankly, she doesn't need to eat more. She needs to eat probably half as what she's eating.
I'm seeing these issues because you are restricting. The first...
Yeah, you're restricting as much as Tess Holliday is, babe. Where do these people come from? Delusional Island? Are you guys swimming in, coming ashore somewhere here in America to tell all these fucking foolish stories from your fucking homeland, Delulu Island?
Doctor to see the whole picture. The first doctor to ask all of the questions before making a judgment.
Alyssa needs to get a DNA test done because I think her and Tess Holliday probably come from the same ancestral line.
And that's why I said to the girls off camera before we started recording, the one thing I will say, and I will put my whole body into this, the only medical advice that I am going to give you is to find a doctor who gives a fuck.
Yeah.
Find a doctor who gives a fuck about you.
I think most probably do. Most people become doctors because they want to help people.
Yeah.
I don't care if you're fat or skinny. Everyone deserves to have a doctor who cares about them.
And, shitty guy with a microphone, that doesn't mean, oh, well, they give a fuck when they tell you to lose weight. Fuck you. Continue.
Are they talking about Alan Rogers?
Well, I was gonna say, just the fact that, like, you were having blood sugar issues, your blood sugar was going low, you were getting faint, those things.
Oh, yeah, remember that?
And, like, your doctor wanted you to look at your blood over a course of time to see what was happening, right?
Yes.
And then to, like...
I can't believe her doctor wanted to look at the bigger picture. Crazy.
Gather information about what was happening before or after that. Whenever I went in, I had something...
Her doctor wanted to do a survey. So what did you eat before your blood sugar skyrocketed? What were you doing when it plummeted? Yeah, that makes fucking sense. Let's figure out what's going on before just fucking putting you on a pill. Because your lifestyle choices affect your health and your weight.
Unusual in my blood work. He goes, what'd you have for breakfast this morning?
Jesus Christ.
And the answer for that morning, apparently, was the answer. I mean, like, literally one meal. You know what I mean? Like,
That's the
well,
answer.
you ate that today. It was, by the way, it was a piece of toast. All right. You ate
A piece of toast or a whole loaf of bread?
bread for breakfast today. And I'm like, okay, well, I ate eggs 2 days ago. Like, what the fuck? You didn't ask that. You know what I mean? But that's the difference. And I will say, take those as cues.
Yes.
Take what questions they ask you as cues to what kind of information they feel they need to actually care for you.
And how
Well, if your doctor's asking you what you had for breakfast, maybe he was wondering like why you ate, because maybe your labs were supposed to be fasted, or maybe your blood sugar was super high and he was wondering what did you eat this morning? Did you eat something to trigger your blood sugar levels? He's just trying to figure out what the fuck's going on, and you're like demonizing literally every single thing your doctor's doing. See, they're like, find a doctor that cares. Okay, well, your doctors are caring and you're getting pissed off at them.
how they treat you.
Yeah, not
How
just the
they treat
questions,
you.
but the assumptions they make from your answers.
Yeah.
Well, I want to thank you, Alyssa, because after
And the assumptions that they're making from your answers. You mean coming to conclusions?
all of these doctors were congratulating me for my body shrinking when I was like, I feel like
Shrinking. She was once a dainty 5'5". When she went to the doctor, she was 3'11", shrinking.
I'm fucking dying. You told me to go to Dr. Everett, and I went to Dr. Everett. Now Dr. Everett is my doctor. And Dr. Everett was like, are you eating?
Does Dr. Everett have a fucking fat fetish or something?
When I really sat back and looked at it, because I hadn't sat back and looked at it, because all these doctors are just like, congratulations, bitch. Yeah, good job. She's like, are you eating? I was like, I think so. What are you eating?
You think so? Are you just so dissociated you can't remember what you shoveled into your fucking mouth? Because clearly you're eating. You could go into hibernation and be fine for probably a fucking year.
Okay, all right. This feels personal, Dr. Everett, but okay, we'll talk about it.
Yeah, your doctor asking you personal questions. Crazy.
Yeah. Dr. Everett cared.
Yeah. And so far as to, we'll get really into this in a different episode in the series, but how I advocate for myself at Dr. Everett's office is met with open arms.
Yes.
I'm not judged for how I advocate for myself and how I show up for myself. And sometimes that is by asking, hey, let's not take my blood pressure right now. I need a minute to sit in the office.
Yeah.
I was just about to ask you, like, what are some ways you found yourself advocating for yourself?
Oh, I do not get on the scale anymore. I do not get
Perfect. Because why would you need to know your weight? Why would you need to know if you're gaining weight or if you're losing weight? But then at the same time, people in fat acceptance are like, I'm fat and happy. I'm fat and proud. I love being big. Why can't you know the fucking number then? Just because you actually care about how humongous you are.
on the scale. They know that they can ask me for very specific things. Anesthesia, of course, they need to know my weight and things like that. They cannot put it in my chart online. I cannot have access to it. And yeah, I skip over that entire portion. Oh gosh. I wasn't going to share this, but I guess I will. I had just gone to the OB to start asking questions about starting a family and what that looks like, and I did not.
Okay, wonderful pause. If you want to start a family, you need to lose 150 pounds. Being obese while pregnant is dangerous for not only herself, but her baby. If a kid has one obese parent, there's a 50% chance they will become obese. If a child has two obese parents, there's an 80% chance that child will be obese. You are statistically setting your child up for failure if you are obese and not in an active health journey or trying to lose weight.
Not get on the scale there. It was my first time at the office. I said, no, thank you.
No, thank you. No, thank you. I'll tell that to my doctors when they want to bill my insurance again. Oh, no, thank you. Don't worry about it. You guys can take care of it, right?
And the doctor, because Dr. Everett's the best, called ahead and had a conversation with this doctor before she
Which
saw
is
me.
amazing allyship and advocacy.
Allyship. So Dr. Everett is a fucking healthy weight. But she's an ally to all of her fat patients. Great.
Yeah.
Literally, when I didn't just cry for this woman for no reason. Like, she truly, she is doing the work.
Yeah.
She fucking cares.
Yeah.
And the thing
No, it sounds like she coddles you.
is that she's so nonchalant about it that I do want to give her credit for doing the work, but I also think that's just who she is as a human being.
Yes.
She doesn't see you as a number. She doesn't see you as a body. She just sees you as a human being. And how can I help you today?
Yes. But she called ahead and spoke to the OB before I went. And the OB was talking.
Dr. Everett's like, okay, hear me out, sis. You're going to see this woman She looks like Jumbo from Lilo and Stitch. When you see her, if you or one of the nurses tell her to get on the scale, she will throw a fucking temper tantrum and bust out the fucking front door, screaming and crying, and possibly will be calling a lawyer to follow a lawsuit. Do not, and I mean do not, are you listening to me? Do not put her on the scale. Do not ask about her weight, or she will scream so loud it'll shatter all the windows in your office. She just made an appointment. She'll be there in fucking 72 hours. Prepare the staff. Over and out. Click.
With me, that we talk about weight a lot in pregnancy to gauge the growth of the baby. So, like,
there is no fucking way that this woman could get pregnant.
We might need to figure out, how we can do that safely. Is there a different way that we need to...
You don't even want to get weighed, but you want to get pregnant, and you need to be weighed at appointments to see the baby's growth throughout the pregnancy. You shouldn't be even having fucking kids if you can't even step on a fucking scale.
I pray she takes care of her mentals before she starts having kids. Our issues with food and eating don't need to be passed down onto the next generation. Normalize healing before having children. Having children won't heal you. Let the generational trauma and issues end with us.
She looks like she's about to fucking shit her pants, like she just saw a ghost.
So that we're not triggering certain behaviors and things. So I
God forbid she starts a restricting cycle during her hypothetical pregnancy.
It has made all of the difference. And that's why I say this with my whole chest. Forget about everything anyone has ever taught you about health.
She just blinked with one eye again.
And that's why I say this with my whole chest. Forget about everything anyone has ever taught you about health and diet culture. Find a doctor who you feel good with.
Yeah.
Trust your gut. Even if it
I think you've trusted yours a little bit too much.
wasn't a bad experience, it's not the same as it being a good experience.
Yes.
There's a difference.
I'm thinking about a time whenever I had to advocate for myself and it wasn't positive. I got a lot of pushback with advocating for myself.
Absolutely have to for.
Yeah, and I think that's something to prepare yourself for.
All right, let's hear this story about how your doctor told you to fucking lose weight because you weigh 300 plus pounds as a woman, and you should probably be half of that.
And know it's still worth it.
Yes.
Because I don't have to leave that doctor's office and go share a meal and have a relationship with that doctor. I literally don't have to ever see them again.
Which is why I do report them to HR and I do threaten a lawsuit, because this doctor told me that if I continue eating the way that I do, that I won't make it to 50. So they now are in prison for medical malpractice, and I did win $600,000 in a settlement.
So if you need to show your ass, might as well do it for your health. You know
It's
what I mean?
also their job.
It is their job. A couple years ago,
Well, I could never be a fucking doctor. If any of these three women walked into my office, I'd be like rolling my eyes like, oh my God, get the fuck out of here. I don't want you as a patient. You're a pain in my asshole.
I was having breathing issues.
Because you're fat. All right, go on.
I was really struggling, and this is, again, like the story that will be weaponized against me is this story. We had just gone through COVID, where we were very much housebound, and
Guess what? If you are fat and you have COVID, it affects you more.
I was going back to working on campus. I work at a university. You don't park in front of your building and walk right in.
No, girl.
No. The parking lots are far removed. You have to walk a long distance, and it was...
Just like everyone else. Guess what? Students have to walk fucking miles to get to their classes every day. Boo hoo hoo.
Wintertime, the air was thin. It doesn't matter. I was struggling to breathe. I was struggling to walk the distance and without having to take multiple breaks. And
So I went to the doctor and hoped to get a temporary handicap sign for my car so I can park in the handicap section because I'm so fucking fat and can't breathe or walk. But they told me to lose weight instead.
And one of the things that I thought, okay, I am getting so exhausted getting into work.
She can't even walk to work without being tired. Max, maybe 1,200 steps, I bet.
Having this big thing, like there's not necessarily benches everywhere to go sit and take a break. Like I'm really struggling to get into
She has to take a break to walk to work. And that is not a wake-up sign. Oh my God, these fucking women from Delulu Island.
my building. Is there something that will benefit this, will help this situation? And so I thought, again, I'm like, okay, I can work on this. I can work on upping my aerobics. I can work on my breathing, all of that stuff. But in this moment, I can't get into work without elevating my blood pressure, all this stuff.
Yeah.
So I decided I was
Why don't you get a motorized scooter?
going to go to the doctor and ask for a temporary disability pass.
I fucking predicted predicted that? These people are so fucking predictable. These people are so fucking crazy that they're predictable. I could fucking write these podcast episodes myself.
And let me tell you, asking for a disability pass and them seeing it as only due to your size is not a fun activity to do.
That's so fatphobic of them. I can't believe they said that, oh my god.
So I went in there, I described what was happening. I told her, hey, I had looked up what qualifies for this, and one of them is being unable to walk a certain distance. I'm not.
Yeah, probably because you're a fucking paraplegic or have Parkinson's, not because you're fucking 150 pounds overweight.
Able to do that without multiple breaks, without having to stop to get breath control back, etc. And she said, I don't want to give this to you because it will enable you.
Oh my god. And that was not a wake-up call. Her doctor said, get your fat ass up and walk, bitch. Get your fat ass up and walk. Get some steps in, you fat fuck. Who's her doctor? I want to send in a fucking thank you note for telling this woman the truth, because Dr. Everett is not doing it for these two. Dr. Everett's not doing it for these two over here.
Oh my god, Dr. Everett would have given me a fucking temporary handicap sign.
Oh my god, that bitch is so fatphobic. I would fucking stab her in a dark alley if I had the chance.
Allie's violent. She's crazy.
Oh my god.
Yeah.
Can you believe she said that? I can't believe she said that, because healthcare providers are so health at every size and they're scared to get fucking reported nowadays.
She's like, you need to deal with this problem, which is your weight. And if I do this for you, you don't have to. And I
can't snap. Snap. Go off, doc. Reading her for filth.
in that moment, I went preparing myself for the fight. I went in knowing that this
She was preparing in the shower the morning of, if this fucking bitch tells me to lose weight, I'm gonna tell her I'm gonna jump out the fucking window and end it all. And then my family can sue her and make a bunch of money.
would likely get a fight back. And I'm sure there's people, I don't care, whatever. I went in knowing that. And this is what was in my toolbox, okay?
She had a journal filled of comebacks and excuses for why she was super morbidly obese and why she needs the temporary handicap sign. A whole journal full of excuses and reasons.
The toolbox was, okay, well, this is where I'm currently at this very moment, and it qualifies for these things.
And if you don't give it to me, I will be reporting you to the medical board. I will blackmail you for the rest of your life. Or I guess I should say the rest of my life, because you probably will outlive me even though you are fucking 45 years older than me.
Okay, and I can work on those things, but I'm not going to magically be
Oh, you're going to work on losing weight? Lie. Liar.
able to do this, and a time frame of 2-3 months can help me work on those things if I were to go along with your idea that they need to be worked on, right? I need to be able to get to work safely, and that does include my body and my body's ability to get me there. And
Are you going to have a fucking stroke walking to work?
being able to park closer will help me get to my workplace safely. I can't not go to work. And then ultimately, when she was pushing back again, I said, okay, so I would like you to put it in my notes of this meeting
Yes.
that you have denied me this thing due to you feeling like it
Will enable me.
will enable.
So when I do have a heart attack and peel over on the sidewalk and students have to step over me because they're trying to make it to fucking communications 210, that my death will be your fault. And these notes will be used against you in a lawsuit.
Me. As soon as I said I wanted it in the notes, she said, let me go talk to this other doctor on staff. Go ahead.
Let me go punch a fucking wall because you're so irritating. And I need to relieve my rage somehow.
Okay? Talks to the other doctor, comes back. I'm going to sign this for you, but I really think you need weight loss surgery. Da, 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 da. And I said, well,
Really, they hopped all the way to weight loss surgery. Not just cutting back the calories, not eating less, moving more. All the way to the surgery. Yep, that never happened.
I've looked into weight loss surgery before, and I was turned away because of X, Y, and Z. She goes, "Oh, I really don't know what is required to have weight loss surgery," and that's that thing. And so in your mind, you had a solution for me that you actually know nothing about. You know nothing about the surgery itself. You know nothing about this. You just assume that that's the magic answer to the issue at hand.
Oh my God. Imagine having her as a patient. I would quit. If I had like a horrible day, just surgeries going wrong, annoying patients, a bunch of emergencies, and then I have to see her at the end of the day, I fucking quit. Throw in the towel. It was nice knowing you guys. It was great being your doctor, but I just can't fucking do it anymore. She is the camel that broke the straw's back.
Yeah, that day did permanent damage for me
Yes.
with my doctors, me trusting doctors, me thinking doctors will see me, permanent damage on the way I saw myself.
That whole situation type deal should have crushed your fucking confidence. Your self-esteem should have been at ground zero. That should have been your breaking point. But somehow you continued to dig yourself deeper into a hole.
It did a lot of damage that day, and
And then I had to go through a Burger King drive-thru. I got 3 Whoppers, 1 chicken sandwich, a fry, a mozzarella stick, a hot chocolate pie, a vanilla milkshake, and a full sugar Dr. Pepper. And that was all her fault. Worst day of my life.
carried a lot of shame because I think in general, if anyone has a disability, I think advocating for a disability
You don't have a disability. You're fat.
is hard to do, and harder when someone assumes that disability as your fault. Like
You don't have a fucking disability. You just can't put the fork down. Don't try to co-opt the struggle of disabled people. You're not a victim to some sort of unfortunate circumstances, some disorders and diseases, some birth defects. You're just fucking fat and refuse to lose weight.
she absolutely saw that as I did this to myself, etc. Right? Versus just understanding there was no way for me to get past the issue I was having without some support. And
Rosie Beam talked about this. I don't know if it was on her stories or maybe it was on her post, but she's on a weight loss journey. And before she got her gastric, I don't know if she had a sleeve or like, I don't know the difference between any of the surgeries. Her breathing and like lung capacity was pretty low. And then she's lost a bunch of weight since then. And her lung capacity has gone back up. Your weight has effect on your breathing. I mean, I know it takes a while to lose weight and shit, but it's like, I think your doctor would be more understanding of your circumstance if you even were in the process of losing weight. But your doctor is right. Giving her this temporary handicap sign is enabling her bad behaviors. Instead of losing weight and increasing her lung capacity because her fucking fat is weighing down on her lungs and she can't breathe properly, she's like, oh, I'll just like do aerobics like once every 2 weeks to help myself breathe better. No, sister, lose weight, then you can fucking breathe. This isn't long-term COVID. This is adipose tissue.
I think that's, she saw it as enabling. I saw it as support for me living a healthy lifestyle, which
Support of living a healthy lifestyle. You mean not walking?
would be being able to go to work and not have my blood pressure and my breath go out of sorts just to get there.
Also think about the mental toll that was taking, knowing what you were dealing with every time you were going to work, like what you knew that you were having to prepare yourself for and going to work.
Yeah, you should be stressed out if you're fat as fuck because you need to be dealing with it instead of ignoring it.
And think about all the people that don't have these tools, that don't have the...
Yeah, because you guys are so much more stronger and smarter and have access to such great physicians
that aren't prepared to put up that fight at the doctor's office, who will then say, well, you know what, I can't
Well, you know what? I guess I better lose weight. Gee golly.
do it anymore. I can't do it anymore. So they either lose their jobs or they try and fight back.
So they lose their jobs? No, they'll probably just start to fucking lose weight. Hopefully.
Work from home if they're able to. We know that that's a privilege, but you know, it's so invalidating, and it's so like, why is it wrong to ask you to care that I do want to participate in this world as best as I can? And I'm just asking.
If you want to participate the best that you can, then you should probably consider no longer going through the fucking drive-thru for every meal, ma'am.
For some support.
Well, and that's my question. Like, what if my breath control didn't get better?
So do you want to permanent handicap sign them?
I'm just what? You just want to punish me? You want to make sure I feel it? You want to make sure I struggle to get to work so that I know?
Yeah, so then you rethink all of your life decisions and start to lose weight.
It's my fault. Like, what does that mean, right? Like, what do you want for me to then experience? Hardship going to work, scary moments where I can't catch my breath. That's what you want me
Yeah, they want you to have a breaking point.
to experience because it's my fault?
And it's so disgusting.
Whose fault is it then? Your lungs? The doctor's fault? The air? Whose fault is it?
Because these doctors will constantly, oh, well, just lose weight, just have, I had a friend that I was her doctor buddy. And we'll talk about this later on in our series.
Oh my God, are they dragging their fucking friends to the doctor with them?
But it is nice to have a bulldog to go to the doctor with you. And hi, that's me.
I'd be like, nope, no guess, like a tattoo appointment. No guess, sorry, no guess.
But we were going to the doctor for her knee.
Let me guess, because she weighs 350 pounds and she needs a knee replacement.
And this doctor, right out of the gate, was, well, you need to lose weight, and have you thought about weight loss surgery? She was in there inquiring about knee surgery.
Because she's fat as fuck and her knees are crumbling underneath her fupa.
Well, we can't do knee surgery because of your BMI, okay?
Because you're so fat, you're just going to disintegrate it again. But then also, you're so fat, it's dangerous for you to go under anesthesia.
What does my BMI have to do with, well, because of anesthesia. Okay, but you can put me under anesthesia for weight loss surgery, but not for the knee surgery.
Yeah, you have to go under anesthesia for weight loss surgery too, but it's worth the risk. It's life-saving, but also, before you have weight loss surgery, you have to lose some weight to prove that you're serious about this.
Make it fucking make sense. Make it make sense. Because they'll prescribe weight loss surgery all goddamn day long, but then tell you that they can't put you under anesthesia for the actual problem that you're dealing with. Because maybe if my knee didn't hurt so fucking much, maybe I could go on that walk that you think I'm not going on, or what the fuck ever.
Yeah.
Alyssa, you're getting upset.
Yeah, I'm a little upset.
Yeah.
I'm really sorry you were treated that way.
Yeah.
All right, Rebecca, it's your time to cry. Everyone else has cried.
And I think that's where I'm like sitting right now. Is like I started dissociating a little bit because the
That reminded me like of the 45 times my doctors have told me to lose weight too.
people don't deserve to be treated like that, period. And I'm going to say this, people don't deserve to be treated poorly, period. I think people deserve to be treated well. I think people are innately good. These doctors.
What? Thin people are innately good? Girl, that's what you think. No one else thinks that. Thin people are regular people.
Will do something harmful, and I understand they have intentions, and their intentions also matter, but you need to also have the intention of wanting to do good and like learn to do good for
Yeah, her doctor wants her to fucking lose weight. That's good intentions.
all of your patients. And I'm sitting here and I'm just like, how sad and impactful, and also like, we know what we're doing putting this out there, right? Like,
yeah, we're like spreading misinformation.
I'm just like really sitting in the, I
She's such an empath, oh my gosh.
feel the quote unquote, you deserve to be attacked because of the body you're in. And it's harmful. It's hurtful.
Yeah.
It's hurtful.
Yeah. And
She wanted
not
you to
for
feel
our own
shame.
good. Yeah, it's not for our own good, because you know what happened?
She went to the Burger King.
I hid that from everybody in my life except
Yeah.
for a couple friends.
Yeah.
At that point in time, Allie knew me. I think I actually told you about this doctor visit in a dinner. I told a couple friends. I only told my fat friends. Hid it from my thin friends. Hid it from my family. They probably never knew I had a disability tag for a little bit. And at work, I would park and make sure no one I knew could see me before I walked out of that space. Bubble of shame.
No, she weaponized
Bubble
shame
of shame.
against you.
Yeah.
She weaponized.
You should be fucking shamed. You are so fat that you've eaten yourself to the point that you've become disabled and can't breathe. You should feel so guilty for all of your actions. You need to take accountability for getting yourself into that situation.
And she's taking away a handicap spot from someone that actually needs it.
And that does some like really internalized shit. Like all of us might need disability support at some. Like it's
Yeah, because we're fucking old and diseased. You're just fat. That's not justifiable.
just it sucks ass.
And see, that's the thing for me too. That's the thing for me too, is that there are so many fucking people. There are so many fucking people that will come for us online and point at us and all this shit, but nobody's immune from a disability, whether you're born with it or you, I mean, this is very morbid, but You could get in a car crash tomorrow. You don't know. You are not
Yeah, that's why you need to take care of yourself just in case something bad happens. You are in the best shape possible, and hopefully that will make your situation better.
guaranteed the life that you're living right now, every fucking day, every fucking second.
It's true.
So to treat people as disposable and as a fucking punching bag for your insecurities,
All because your doctor said, hey, you should probably lose some fucking weight. These people think I'm disposable. They just think I'm othered. They just think I'm horrible and immoral and they think I should die. No, your doctors are trying to take care of you, but you refuse to do anything healthy for yourself.
it's just the most disgusting, honestly lazy behavior. And
I think you know a lot about lazy behavior.
again, I am looking at you, YouTube reaction content people. You honestly should be ashamed of yourselves. And I know that
You should be ashamed of yourself.
you want us to be ashamed of ourselves, but all we're doing is trying to put out kindness into the world and tell people that they can't
This is kindness. This is enabling. This is poor coping mechanisms.
advocate for themselves, that they matter, that they deserve to be treated with compassion at the doctor, at a restaurant, among peers, among enemies, among who the fuck ever. Everybody deserves a little fucking empathy.
Oh, another middle finger.
We do need to wrap this up, but it just shows there's so much to this conversation because we haven't even gotten to so much we want to talk about. But when I think about this episode, one of the things I want to emphasize as we talk about health in different ways over the course of this year, however many episodes we end up doing on the series, is there is no one right way to do health. There's no one right way to think about your body. You could feel good one day and the next day get back into that shameful spiral or be fearful of the future. You can make choices out of fear for your health that are okay. We are navigating life as best as we can with the information we have. And
unfortunately, you listen to people in fat acceptance, so you're doing a pretty bad job at doing all those things.
And there are lots of messages we get about what is better for us, easier for us, etc. And I think what we need to do as we navigate health is give ourselves grace, but take no shit, right? Like,
grace is only going to take you so far. We all got time limits on this planet.
Really learn how to advocate for yourself. Seek out support that actually is listening and sees you as a whole person. And know that health is one aspect of life, not the only aspect of life.
But if you don't take care of your health, then you'll have no aspects of life because you'll be dead.
And with that, we make decisions as best as we can. I think I already said that. But basically what I'm saying is, I think what I'm trying to walk around it, the idea is, I'm not coming to you as a fat activist who says you can never do X, Y, and Z. I'm coming to you as a fat activist that says fat people are people who deserve compassionate care, who should be respected, who have full lived lives, who know their bodies probably better than you know their bodies. And that means we are navigating a very complex system of health, complex things in our body, since it's socially
She looks like she has fucking jaundice. Her foundation is so yellow.
Unacceptable. And it's okay to show up however you need to show up. But it is important to do no harm to others. Like, it's important to think about the ways in which you do.
Well, you're doing harm to people because you're spreading misinformation and telling people that they shouldn't take care of themselves properly. Okay, jump scare. It's the next day. I have no makeup on. And in case anyone cares, my eyeliner, my eyebrows, and my lips are tattooed. So that's why I look like this with no makeup. And I have a zit for like the first time in fucking 3 months. But no pimple patches. All right, Rebecca, what were you saying, my love?
Do and think about things and say things that then impact others. And I think that's why so much of it for me personally when it comes to my health is like, I want to do XYZ for myself and everyone else can make their own decisions. And I'm very body autonomy from that point on. That might have been squirrel. Spaghetti salad.
I think honestly, like we had talked about including this, in the episode, and it still scares me a little bit because, in the same way that you scare me, Alyssa, when sometimes you are just so vulnerable with the thoughts that come into your head, and I immediately think about, well, I'm a fat activist. I'm supposed to say this. I'm
supposed to parrot the same talking points as everyone else, or people are gonna deem me dead.
I'm not supposed to feel this way, but I think it is okay. I think it is okay to acknowledge that I'm not sitting here as a fat activist saying that anybody's life is better no matter what body you're in. Everybody faces hardships.
Yeah, but if you're a healthy weight, your life is probably better than someone that's fucking bedbound. You don't get to enjoy a lot of things in life when you're so fat that your body has been molded to a king-size mattress on the floor.
I can recognize that being in a smaller body gives you, we've already talked about the access that gives you, right? But what it ultimately gives you is so much more access to compassion,
To compassion. No, you can just do things when you're a healthy weight. It's not having access, it's not privilege, it's just having the fucking capability of doing things.
passion, the benefit of the doubt, to
Recognition of your
human
knowledge.
The benefit of the doubt. Well, the thing is you're fucking fat, and that's why you have a bunch of health problems. And since 35 fucking different doctors have told you to lose weight, and losing weight would help all fucking 15 of the disorders and diseases that you have, you should probably consider losing weight. It's not your doctors being fat phobic. They can't give you the benefit of the doubt because they literally know why you're having issues. And it's because you're humongous.
human decency,
Mhm.
right? So
Human decency. It is not decent to tell people to lose weight, even though it would make their health better.
yeah, is it quote unquote easier to be smaller? Sure. I won't deny that. I won't deny that. But what I am sitting here saying, and I think what
So you purposely make your life harder on purpose? Yeah, sounds about right.
the general idea of our podcast is that you can still live an absolutely beautiful life in whatever body you're in, because you can take control and you can advocate for yourself and you can.
Tell me, what is so beautiful about being rushed to the ER when you are having a fucking stroke? What is so beautiful about not being able to tie your shoes or wipe your own ass? What is so beautiful about forcing your loved ones into being servants for you because you're 600 pounds being bedbound and need to eat all waking hours of the day? What is beautiful about having expensive healthcare premiums and being in medical debt? What is beautiful about going to the drive-thru multiple times a day? What is beautiful about gasping for fucking breath when walking up 2 stairs to get inside your house? What is beautiful about getting knee replacement surgery at 35 because you are so rotund, it is crushing your joints? Please, what is so beautiful about that? Nothing. That is fucking miserable. That is sad. That is pathetic. That is a life that no one should want to live, but people are so used to living in that misery and having that be their reality that they can't imagine their life being any different. There is more to life than eating food and sitting in a triangle with your other 2 fat friends bitching about how horrible it is to be fat, when you can make a fucking difference in your own life and change that. These women have been to multiple doctors for multiple different health issues, and they have been given the same answer. They have been prescribed the same thing for every single one of their issues. Lose weight. That is how you will fucking get better. That is how all of their health would improve, but also just their general well-being. But instead of shutting their fucking mouth, eating less, moving more, getting better sleep, drinking more water, finding hobbies besides eating, they made a podcast to bitch and moan. Also, guys, am I kind of giving Winona Ryder? Tell me in the comments. Or I'm never going to make a fucking YouTube video ever again.
And say, just because I don't have all the access that somebody else does, doesn't mean I can't create space for myself.
You have access to plenty. How many times have we heard you motherfuckers talk about going to the doctor in this podcast? You sure have enough access to money to gorge yourself to this size. You also have access to buy makeup and glasses and podcast equipment.
And I think that's what I'm doing.
Yeah, because as much as people like to say thinness is an option for everyone, thinness is not.
Healthy weight is an option for everyone. No one wants you to look like Ariana Grande. No one's asking you to do that. People are just telling you, hey, if you would like to be able to fucking walk into work without gasping for breath like you are drowning in the Atlantic Ocean, maybe you should consider shaving off some fucking lbs. They're not asking you to be thin, a little dainty. They're not asking you to go on America's Next Top Model. They're asking you to like lose 50 fucking pounds. Oh my God.
Yeah, because as much as people like to say thinness is an option for everyone, thinness is not an option for everyone.
Losing weight is free. Leave like 5 bites left on your plate after you eat every meal and you'll start losing weight. Like, it's literally not that hard. You don't need a GLP-1. You don't need weight loss surgery. You don't need a fucking nutritionist or dietitian or personal trainer. Just cut back on the calories.
Not.
It is not an option for everybody. And that is
Oh, right. Yeah. Because 80% of people are fat because their ancestors survived famines. Yeah. Right about that. I'm sorry.
my number one protector against all of the hateful, hurtful online comments.
Is a family size pack of Oreos. You know, I could just engulf one of those and forget about the world and all of my issues until I have to wake up at 3 a.m. to diarrhea.
So number one thing they love to tell me is stop eating.
I can't stop eating. I'm Italian. That's my whole personality. That literally is the solution, to stop eating. And we're not saying to not eat anything. We're not saying to eat 0 calories. Eat a little less, lose a little weight. You'll be good. Don't worry about it. But you can't do that because being fat is your personality.
Mary say, bet. I already did that. I did that so much.
For what, 2 hours?
I ended up in a medical facility.
Yeah.
It's not one.
Because you have BED. You restrict, get obsessed with food, then gorge, then feel guilty, then restrict, and you do it over and over and over and over and over again instead of getting the fucking proper treatment that you need.
It's not 1 + 1.
It is. It is. Go to therapy. Find a therapist that will be on your ass and hold you accountable. Get a therapist that doesn't believe in health at every size.
It's not, don't do this and then you'll get this.
Scream it into the void if you need to. We just know it's not true.
It's just not true. Right? And that's when I'm like, this is when like, I know I've said things that we don't all necessarily agree on, but I stand by, no one wants to receive this type of hate.
Is it hate or is it literally critique? Besides when I call you John, but that's kind of hate. In my eyes, I'm doing a little comedy, so unfortunately, you're gonna have to be the ass end of the joke.
I had the option to be in a more societally accepted body and the privileges it comes with that. I don't know if I wouldn't take that.
Everyone that's fat would take that. Because deep down, no one wants to be fat. Tess Holliday doesn't want to be fat. You don't want to be fat. I don't want to be fat. Viewer, you don't want to be fat. My mom, my dad, my sisters, my brother, like every single one of my friends and family, no one wants to be fat. No one does. Nothing's good about being fat.
Why wouldn't I want the acceptance?
Yeah, you want it, but you're too fucking lazy to do anything about it.
I literally starved myself for it.
And we've all done it.
That's what I'm
We've all done
saying,
it.
you know?
No, not all of us have BED. Some of us, like myself, we just don't stop eating. That's how I got to 272.8 pounds. Munching, snacking, grazing, eating all day.
And like that is truly my number one protector against all of the nonsense.
And I think that's what they can't understand.
Correct.
These very, very hateful, toxic people. They can't understand, why wouldn't you? Why wouldn't you want to be like us? Well, first of all,
Well, the thing is, the people that are giving you the critique are most likely people that have been in the same circumstances as you. Every single person that I know of that makes this type of content has had some problems with eating, whether that actually be a diagnosable disorder or they just had overeating problems like myself. Most people in this space have lost a significant amount of weight or are on a weight loss journey. So it's like, I am her, she is me. We all are more similar than we are different. And that's what people in the fat acceptance community don't get. People that critique fat acceptance were either in fat acceptance like myself. I think Megan and Same Whatever Size were also into like the fat acceptance stuff. Or they just had BED or other mental health issues and kind of believed in a lot of the same things that people in the fat acceptance community say. But all of these people that make anti-fat acceptance content are now on the other side and are trying to help people out. It's not haters. You guys don't have haters. You have people critiquing you and telling you that what you believe in is total fucking horseshit. You spew misinformation and you are enabling each other and yourself. That's what your haters say. That's not a fucking hater. That's someone with a working brain. That's someone who has been in your position but has gotten better. And you can't stand to see someone that was in the same position as you succeed. You cannot imagine getting better because you are so engulfed in your own toxic thoughts that you cannot even imagine what life would be like not doing all this shit.
I wouldn't want to be anything fucking like you.
I don't want to be hateful.
I don't want to be anything like you hateful, shitty people with your reaction channels.
Well, you said you'd want to be thin, so you'd probably rather be closer to my size than your own.
I do. I have a real fucking problem with you people. I do. But I'm thinking of one guy in particular with a very shitty mustache.
Ooh, his shitty mustache. Maybe is he talking about cynical dude then?
Anyway, sir, if you're going to talk about her, she can talk about you.
I mean, honestly, like, you have such an issue with fat people, but do you realize that you sit and
Cynical dude has also lost a lot of weight.
watch videos of fat people all day, every day, and talk about fat people? Like,
We don't sit around and watch videos of fat people all day, every day. It's usually for like maybe a couple hours. Like for myself, I try to batch film, so I'll stay here for a couple hours and film and then edit and then post it throughout the week, but then I'm done. Maybe I'll watch some girl world videos about 𝒹𝒾𝓈𝓸𝓉 and Foodie Booty and Alex Rodriguez or Glitter and Lasers, but that's not my whole day. Like I have other things to do. I have a business, I have a husband, I have dogs, I have to exercise. Gotta do laundry, dishes, cook. Our lives don't revolve around fat women on the internet. Our lives revolve around balance. Self-discipline, but enjoying life. Doing the hard things, but it being worth it in the end.
I think maybe you should talk to somebody and, like, not yourself on a
No,
microphone.
like, and when she says somebody, she means a licensed mental health professional, because what you're doing, not normal.
It's weird, man. It's weird.
So it's not weird for you guys to talk into a microphone, but it's weird for people that are anti-fat acceptance to talk into a microphone? That seems like a double standard to me.
It's weird. Get help. Anyway, to
everybody else.
To everyone else. We love you
I thought you said you don't tell people to get help.
so much. No, it truly is, like, I'm not sitting here saying being fat is the best thing in the world.
Obviously, because you just bitched and moaned about it for an hour and 4 minutes.
Because I have received so much hate and shame and hurt just for living in the body that I live in.
That you live in? That you built brick by brick? You're not a fat person, you live in a fat body. Right. Continue to dissociate yourself from your fatness.
I have done everything I can possibly think of to change this body other than medical intervention.
I have done everything I possibly can to lose weight except seek help.
And I don't blame anybody for going that step, for going that route, whether that's surgery, whether that's a shot, whether that's anything. Because like Alyssa said, who wouldn't snap their fingers and get that privilege?
Yeah, but
Get that privilege. Is it privilege if you have to work for it? It's being dedicated. It's taking care of yourself. It's not white privilege. It's not like you're not just born being fucking thin or a normal sized body. Like you have to maintain it. The same way that you have to fucking maintain being fat as fuck.
these are our bodies. We are living in our bodies, and we are allowed to protect and advocate for these bodies.
Yes.
And that's all we're doing here is telling you how to show up and show up for yourself and live a beautiful life in the body that you're in.
Yeah.
And you don't, like Laura Adlington said, you don't have to live small because you live in a bigger body.
Yeah, I really think that. I really think it's about pressing against those limiting beliefs that you deserve the worst health care. You deserve any of that. It's just not the case. And
not everyone struggles with self-hatred like you guys.
And I hope as we explore these health topics that you let us know which ones you are personally struggling with. I know that at some point we'd love to hear y'all's stories and what kind of medical things you want for yourselves, but maybe it feels like a prevented to access it because this shit is complicated and shame makes us not talk about it with others. And it's just time to be like, I get to see the table. I get to see the table. I get to talk about this, and I get to talk about it with my doctors. I get to talk about it with strangers. I get to talk about it with mustachioed assholes. I get to talk about it to anyone I fucking please, right? And that's because it's important to me. So I'm allowed to make it important and demand it to be important to others, especially the ones that we pay to kind of give us medical care.
And what we've done here, with what Rebecca said, we deserve a seat at the table. That's what we're doing here is we've built the fucking table, along with every other fat activist, along with every other person.
Yeah, you guys are going to break the damn table, too.
Who's willing to stand up and say, I deserve better.
Stand up? I think you guys only sit down.
We're building a table, all of us.
And I know it sounds like we're like really letting the trolls win, but I just already know they're like, yeah, I bet you're building that table. And you know, if it's a buffet with lots of options on it,
You got yourself, got him.
we love that for us.
Because you know what? We have no shame about going back for fucking seconds at that table while y'all are sitting there like, ooh, I don't know, baby, I can't. How sad for you.
And some of us are working through that shame.
Sorry, babe. Oh,
Okay,
shit.
queen.
And on that note, we're fat.
Yeah, she's in recovery, Allie. How could you say that?
We're fab.
And we are friends. And we'll see you guys next
I don't understand the friends. That's not in the title.
time. Bye.
All right, let's rot our brains and see if there's any horrible comments. Thank you, I needed this one. I went to see a doctor because my feet were turning blue and my left leg was swelling. All right, so you're having problems with circulation? This was the first time in after 5 years because I had gotten medical insurance. He took a look at me before doing blood work, before my blood pressure, which was at a healthy level. Before even looking at me, he asked if I considered bariatric surgery. It's traumatizing. Things that never happened for fucking 1,000. The first thing you do when you go to the fucking doctor's office, well, at least in my experience, you check in and then a nurse grabs you, throws you in a room, does your weight, height, pulse, temperature, and blood pressure before the doctor even comes in. Thank you for such a caring episode. Fat pregnancy and fat motherhood has been traumatic because being obese while pregnant is extremely dangerous for mother, but also baby. Most of my negative health related interactions unfortunately relate to that part of my journey. I'm glad you have all learned so much along the way to get the best care you can for yourselves now. Health in children is also so complicated. Is it though? The number of kids who do not get to be children, who are shamed or sexualized or punished because of their bodies, all in the name of care and health. Who is sexualizing a kid in the name of care and health? Like, what are these people talking about? And kids shouldn't be shamed or punished for being fat. Their fucking parents should, because it's their fault that they're fat. Why? I can't believe there's no negative comments. They must delete them. Thumbs down. But I will subscribe. I want to make sure I see if you guys post anymore.
I think this might be one of the longest videos I've posted on YouTube.
Holy shit. It's one thing to react to fat acceptance TikToks and Instagram Reels because those videos can only be so long, especially when you're trying to pump out content and you want people to see it and you want to be in the algorithm and stuff. You got to be short and catchy and to the point and not put in a lot of description of what's going on. You have to be really vague because people have the attention spans of squirrels. So watching an hour-long episode of a fat acceptance podcast really just destroys the little amount of brain cells that I actually have left. These women literally have no fucking idea what they're talking about. They spread so much misinformation. Their insecurities cloud their judgments so heavily that they can't see that their fucking doctors are trying to take care of them. They've doctor shopped and they've gotten the same answer from every fucking provider, which is lose weight. I'm assuming this, but I'm fucking putting context clues together. But the fact that Allie has had a parent die because of his weight, her dad died. It seems like he died within the last couple of years, but it's the fact that one of these 3 women have had a family member die because of weight-related issues, and the fact that they are still in the fat acceptance movement and cannot see how flawed their own thinking and behavior is absolutely fucking mind-boggling to me. Allie's dad has died because he was fucking super morbidly obese. Alyssa has type 57 fucking diabetes. Rebecca, I don't know if she has PCOS or endometriosis, but there's something going on in that uterus that isn't good. She also can't fucking breathe. Alyssa also has an ED. The laundry list of ways that eating and weight has affected their life is astonishing. And it's so you got 99 problems and your weight ain't one. Really. It's how do you not see the common denominator in all these things? No, just me. Just me. All right. Maybe I'm just the fucking smartest person alive, so I can kind of see where the doctors are coming from when they say, yeah, maybe you should start losing some fucking weight. Put the fork down, tubby. Unbelievable. It's really unbelievable. These ladies are fucking wild. These women live on a different planet than myself and us. Let me know your opinions about this podcast episode. Let me know if we should watch more podcast episodes from the Fab Fatties. Honestly, I could sit here and fucking watch all of them. I might lose my voice and scream and maybe give myself high blood pressure. But nothing some deep breathing exercises can't fix, right? Like, a small part of me can give them a little bit of empathy, but at the same time, I'm like, you guys are fucking grown women. And you guys are in your mid to late 30s, almost middle age. 40s are coming up very quickly. Things are only going to continue to get harder for you. As much as I think they're all fucking babbling idiots, I do hope that they somehow see the way out of the fat acceptance movement and take care of their health, because I would be sad if they were no longer here, because I don't want to see anyone be removed from Earth because of obesity-related illnesses. It's something that can be prevented and taken care of, but it's just whether that person or we or us or I take accountability for our actions and do something about our lifestyle habits, which I have done and most of you guys have done too. And I'm proud of you guys for taking care of yourself and losing weight or maintaining weight or gaining weight if you were struggling with being underweight. But make sure to leave a comment down below. If you've made it this far, then leave some doctor emojis in the comment section. If you enjoyed this video, make sure to like this video. And if you enjoy me, consider subscribing. I would love to see you back here again. I hope you have a great day. Take care. Peace.